And I'm going to be talking to you today about keeping your child safe during COVID-19. I am a CHOC-associated physician as well as a Hoag physician. I've been at Hoag Hospital since 1997, so I'm almost to 25 years here. Because we are pediatricians working in the pediatric world, we also have some ties to CHOC. I have been continuing to be part of the CHOC Primary Care Network, as well as helping Hoag with programs such as this, as well as infant and toddler rounding at the hospital. Today I want to talk to you about keeping your child safe for COVID-19. One of the most important questions people ask me is, why do I even have to worry, or do I have to worry about COVID-19? Well, the answer is, unfortunately, yes. We all have to worry about COVID-19. Certainly children, including young children, can develop COVID-19 and COVID-19 symptoms. They certainly do not develop the same severity as adults, but it can be quite severe in certain children, particularly those that have complications or long-term health illnesses. Who are those children at most risk? I've listed a few here just to see, though I'm going to focus my talk mostly on keeping the well child, or in other words, the regular children in our community, safe. But certainly anyone with any of these conditions should clearly be extra careful in following the regimen that we're about to discuss. Children that have conditions with the lung, the heart, have any kind of obesity, any kind of immune issues, any kind of neurologic issues, kidney issues, premature babies, or any kind of complex medical issues. Those children need to pay extra close attention. Certainly, even if you do not have risk factors, you need to pay attention to keep your child safe. Today, my goal is to give you some basic tips and tricks to try and get your children to feel safe and to have it be fun for them, which is the only way for children that we can make it work. So, the first question I ask is, what's the most important thing when it comes to helping to keep your child safe for COVID? The most important thing is prevention. Because we don't have any cures or medication or any miracle things to treat COVID with, the best thing we can do as parents and as care providers is to prevent our children from coming in contact with COVID. The key things with COVID and avoiding COVID are some pretty basic concepts. These include things such as avoiding contact with anyone that's sick. This seems pretty straightforward, but it's really important. I came up with a phrase that I hope you guys will try to remember, a phrase that's called ask, observe, listen, and do. That phrase is to ask ahead of time during the times you are places, to observe and listen to what's going on. And certainly the last of it is to do something about it if you see that your child might be at risk. You have to get comfortable to ask whoever and wherever you're going if anyone is sick. I cannot emphasize this enough. Do not be afraid to ask. If you're visiting your sister-in-law, your mother-in-law, your grandma, anyone, just please reach out to them and just say, hey, I'm just checking to see if anyone is sick. It's a simple question, and it's sometimes very difficult to ask, but this is one of the most important things you can do to help keep your child safe. You can blame it on me as your doctor, blame it on my pediatrician said to do this. You can say, oh, we might be traveling next weekend, but don't forget to ask. Secondly, you also want to avoid contact with anyone who has been in close contact with COVID. Again, this seems pretty obvious, but it isn't so obvious. You would be surprised if you were in my position where people come in, and if you don't ask, you really don't know that they actually happen to be in close contact with someone for COVID. So if you're going somewhere, ask if anyone's sick, ask if anyone in that house, that play group, or that area has been in contact with any known COVID people. The third one is to limit the number of visitors or people that are visiting with you or your children, especially if you have a new baby. Even more important for a premature baby or children with those significant medical illnesses. Don't be afraid to cut down on the number of visits during this time, and particularly when COVID numbers are high, this is very important. Fourth on the list is to avoid crowds. We've all been hearing this, and it seems very straightforward again, but it really does make a difference. The more people you're around, the more increased risk your children will have for COVID. Not to say you can't go out and have fun, and there's many fun things to do with children, but if you can, particularly during high peak COVID time, avoid those crowded theme parks, crowded restaurants, large, huge gatherings where you have no way of being able to ask if anyone is sick. Indoor gatherings are also a pretty sensitive kind of place because there may be poor ventilation in these places. So try to be careful about where you choose to go. Another thing is keeping a safe distance from people. Certainly this may not be your loved ones or people you've already asked if they're COVID-free or if they're sick or they're avoiding any sicknesses, but it's not that easy to do. Sometimes when you're out and about, you may hear someone cough or see someone sneeze or see a child with a runny nose. Those are the kind of people that you really have to be aware of. That's part of the listen part that I was talking about and the observe part that I was talking about. If you hear someone cough, you see someone with a runny nose or sneezing, don't be afraid to do something. That means step away, politely find another elevator, politely find another place to be with your child. Whenever possible, this is a really tough one, but whenever possible, try to avoid bringing your child into risky places that are crowded and you can't tell who's there or who's been there, especially again when COVID numbers are high. Shop online when you can. Try to leave your child at home with a responsible adult. You can trade off going to the store with your neighbor, with a spouse, with a friend, or a trusted family member. This is especially true, again, of newborns and anyone with premature babies. It's highly recommended for these two categories, the newborn and the premature baby, to keep these babies at home, especially during their first 2 months of life. I think you'd be surprised how much people would appreciate having to trade off with you other moms who would rather go to the store alone. So again, don't be afraid to ask. Another important thing is to try to focus on your travel and your vacation plans in a wise manner. Check the COVID rate in areas you might consider going to. Consider traveling by car instead of traveling by public transportation such as planes or trains. Don't be afraid to ask a hotel that you may be looking or considering if they're doing anything for COVID that's special. You can inquire about their cleaning protocols, and even when you get there, be aware, does it look like the room's been cleaned? Believe it or not, it's pretty obvious when hotels are taking extra precautions. We've all seen those little buckets with the clean pen and the dirty pen, any kind of things like that, any kind of tapes that are placed on the rooms that you go to. Those are all great signs that the hotel is taking extra precautions in order to protect you and your children. If you don't feel like they're really doing much different, don't be afraid to drag along a big container of sanitizing wipes or a spray. Get into that room early before your children have a chance to touch every surface in the room. Do a quick wipe down on any high contact areas. It only takes about 5 minutes to really wipe down every surface area in a hotel room. And I'll be honest, I've done it. Even if your husband makes fun of you, honestly, the joy of relaxing in a hotel room that you know is clean is really worth the extra 5 minutes to just do it. The last thing I'm going to say, as I've mentioned already, is to check COVID updates. I believe the two numbers or websites I have are on the screen right now. There's a COVID-19 Orange County Health Information number, as well as the COVID-19 or the CDC.gov email address. Those are the best addresses you will be able to find to see if there's any kind of problems in the area you are or the area you're traveling to. I know it seems crazy, but I even fell into the trap of making a vacation plan and 2 days before decided to check this and was absolutely blown away, realizing that their numbers were completely different than ours. And when I was looking to go out because our numbers were doing well, the numbers of the place I was looking at were not great. So we had to make a lot of last-minute plans. So don't be afraid. The minute you start checking this, check these sites and see what's going on in the world around you. The next topic I have is of great importance. Although sometimes it can be a little bit controversial, there's no doubt these play an incredible role in the decreasing numbers of COVID-19 and the prevention of the spread of the illness. What is this? It's masking. And masking is something that is very out there. There's political issues going on, but what's one of the most important things that our kids can do is to have their masks on when they're out and about. And the amazing thing about masking is that kids have been masking since I started pediatric practice. Kids love wearing masks in general. Now granted, they didn't used to have the little tie around the ears. A lot of them had full facial masks, full headgear. It's amazing to me over the last 25 years how many times I've had kids come into my office with masks on, Halloween costumes on, and all sorts of different little outfits. We have to learn to take advantage of those kind of fun things that kids see. And if we role model that these masks are helpful and that they're fun, the children will find them helpful and fun. Believe it or not, our children follow our little incentives in amazing ways. I brought along a couple masks here to show everyone, and sometimes they've become a little bit more controversial at the beginning, which at the very beginning we were all looking for these N95 masks. This is kind of the gold standard for hospital-based personnel and nurses, doctors, people who are dealing with COVID patients. It's certainly probably the most essential mask for anyone that really comes in contact with someone who's directly COVID positive. This mask may be helpful for you if you truly have someone in your house who has COVID and you don't want to come in contact with this. This could be worn to protect you, or it could be worn on the person that has COVID to protect them from getting any kind of infection to people in your home. For the most part, the N95 mask is not that essential on a daily basis, but under special circumstance, it may be helpful. There's also the KN95 mask, which was developed to help anyone who did want something as close to the N95 mask as possible. It's a great mask. It's easy to find online. It does also have a little bendable, flexible metal template in the middle, easy to put on. The reason the KN95 is not quite as good as the N95 is because it does go around your ears as opposed to around the whole head. It doesn't form quite as tight of a seal, but the fabric that's used and the design of it are fabulous. In addition, we have the good old-fashioned medical mask. These are pretty darn good, and for most scenarios, I would stick with this for your children, for yourself. Ironically, we have a lot of really great masks that make it really wonderful and fun for our children. They're little fun, little Disney masks. We have fun cloth masks. The medical masks even come with a little bend in them as well for children to wear an almost medical-like mask with a pediatric size. The reason this is better for your children is because it does keep it snugger against their face because it's built more to the size and shape of your child with earpieces that are small like your child. So all these different masks, there's plenty of things to look at, to consider, but the most important thing is that everyone over the age of 2 should be wearing a mask whenever you're going out into a public place. These public places are places you can't always tell whether there is someone who's been there with COVID or might have touched or been breathing like right there in the air. It is true that COVID doesn't last in the air very long, but it also takes very little time to put on a mask and be sure that your child is protected from that. So everyone over 2 should be wearing a mask when they're in public places. If you're outside and you're doing something close contact with other people, I still would recommend wearing a mask. If you're outside and you're not in close contact, it's fine to take those masks off and run around and feel free with that. When do we do them? Again, just as I mentioned, in close contact with others. What mask is best? What I would say what mask is best is the mask your child will wear. So even though the KN95s and the medical mask may be slightly better, if your child is much more willing to wear the poo mask, put the poo mask on them. These are really important to make sure that your children enjoy putting these masks on. Make it fun, make it exciting for them. I just had a couple kids today that I asked, do you mind wearing your mask? One was a 3-year-old, one was a 6-year-old. Both of them said, no, not at all. One of them even told me she likes wearing it because she feels like it keeps her face feeling cozy. So one of the things I want to encourage everyone to do is to mirror these actions for your children. Wearing the mask yourself and not complaining about it is one of the most important things that you can do for your child. If you wear the mask without any difficulty, your child will wear the mask without any difficulty. So try to role model for them. The other thing to do is praise them for wearing the mask. Just keep going and encourage them to mask up. The next important thing, and I'll pass by that, is, again, as I said, making all these things fun. I did want to mention one thing with regards to the masks is that the kids do like to be superheroes. And when they wear these masks, one thing you can tell them is that they are being superheroes. In and of themselves, they are protecting others every day that they wear masks. They're protecting themselves, but they're also protecting other people. So when you tell your children that they're doing a big thing and they're changing the world with this, a lot of times kids are really proud to be wearing those masks. So don't be afraid to encourage them in that way too. Another thing is hand washing. I know this has been talked about at very long, extensive rates, so I will try not to spend too much time on this. The old 20-second rule is pretty important though, and the question is, how do I get my kid to wash their hands for 20 seconds? My answer is, again, make it fun. Start with a little song or a jingle. And if you didn't know, the song Itsy Bitsy Spider, the ABC song, the Wheels on the Bus first portion, and the Happy Birthday song are all roughly 18 to 20 seconds long. If you start them off with some fun song, which you can even make up your own, they will get into the habit of doing it. Wash hands every time your child has been in a public place. If you remember, when your children are in public places, they tend to touch almost everything they can. This is certainly something we try to teach our children not to do, but you almost have to assume when your child's been in a public place, they might have touched some surfaces that might have been dirty or not necessarily sanitized before your child touched them. So whenever your child's in a public place and comes home, try to wash their hands as they leave. Wash your hands immediately before eating, also after eating, and before any kind of food prep. If your children are helping you cook, teach them a good habit before they start to touch food. In general, they should wash their hands with soap and water. Another important thing is to use a disposable towelette or a paper towel rather than using that one kitchen towel hanging on the counter. If everyone's using that kitchen towel, surely that is not going to be the cleanest thing to keep drying our hands on. So try to use a paper towel in these scenarios when we know there are germs out and about. Try to use the towelettes. One thing with hand washing I've learned is in my office, as I wash my hands, I don't even notice I do it. And that's something that I think we can instill on our children. If we get them into the habit, they don't even know they do it. As far as the fun aspect, I can't tell you the number of times I've been washing my hands where I've had kids come over begging me to do it on their own. Because kids like to play with water, they can have hand washing be fun. So remember, try to wash your hands anytime you can. Certainly the CDC does recommend washing your hands with soap and water, any of these scenarios. But if soap and water are not available, the next best thing, as we know, is to use some hand sanitizer. The hand sanitizer's, again, the next best thing, and does come, as you can see on the screen there, in multiple different sizes, shapes, colors, smells, all sorts of things. I've brought a few more as well, but I think the screen shows a lot of different things. It's amazing to me how many ways we can go to make these sanitizers fun. I've seen them in Superman bottles, I've seen them in Barbie bottles. You can even take a bottle of hand sanitizer and create it looking fun on your own. I've found some really great sprays that just give a quick spray and on your hands it goes. If you kids don't like to do the little rub around, that kind of thing, taking a spray that's almost like a sunblock and just swirling it on their hands really quickly. Works great, different form, same job. There's obviously pumps. There's obviously the scented spray, which is lavender seems to be one of the kids' favorites in my office. We have a lot of people that have brought the lavender sprays in to the point where I've even learned to like them. So important to do with the hand sanitizer, again, get what your kids will use. Don't make it a chore for them, make it fun for them. Okay guys, let's spray our hands. Shh, you get a quick little spray there, everybody rubs them together and you're on your way. On the note of hand sanitizers, a lot of parents worry about hand sensitivities. Most hand sanitizers do not cause skin sensitivities in children. If you're one of those people that has a really sensitive skin child, one of the most important things is to test it on the inner arm before you use it in a large surface area. You can even take 1 or 2 drops, test it on the inner arm, and if you see no reaction, that's when you can go to the hands. The hands are covered with really thick skin, so usually we do pretty well with hand sanitizers. The one thing we do have to, and I want to mention with hand sanitizers, is that we do want to be sure that we keep these in safe places. Because they contain alcohol, we do need to make sure these are not ingested by children. Obviously, big bottles of alcohol like this, or even a big bottle like this, given to a 2-year-old who might be trying to taste it just for fun, which 2-year-olds do, that can be a huge problem. So keep in mind these when you have your hand sanitizers. If you have smaller children, you may consider having smaller hand sanitizers so that there is not a large volume in your purse or access to children. Certainly putting these hand sanitizers up and away at your home is also very important. Face shields and visors is something I'll cover really briefly. I think more than anything, just looking at the picture here, you can see face shields and visors can be very fun. They're certainly not alone the protection against COVID-19 that you want. We still would prefer you had a mask with a visor. If you're going somewhere like, say, an airport or somewhere that's really high risk at a time that's really high risk, these are kind of fun to add into your mask regimen, but certainly not something to use all by themselves. The other thing that we certainly can use, oh, here we go. Some children have glasses on their own, just as you see in the child in the picture. I've had some great children coming in wearing glasses in the middle of the pandemic that are UV protectant. The UV protectants can be great for computers and all the extra hours they are on the computer. For blue light reduction, for about $10 you can get a pair of glasses for children to wear. Again, not the best form of protection, but certainly an extra thing you can add into your face mask if needed. The next thing I'm going to talk about is just general hygiene, and we'll go through this rather quickly. Obviously, we want to try to keep our children from touching their nose or mouth. One of the things we've all gotten, I think, a little out of the habit on is carrying tissues. I think this is a day and age where carrying tissues is important because if you start to notice your child seems to be sneezing, itching, or wanting to rub their eyes, pull that little small packet of tissues out or a bunch of tissues from a Ziploc bag and bring them out to them and say, don't touch your eyes. If you need one, say, Mommy, hand me a tissue. It's so simple and it's so much more hygienic. If we teach our children to just never let our hands touch our eyes and mouth, most of the time they will listen. There's always those times that they won't, but you have to be able to carry those tissues in order to encourage that behavior. Teach and role model this behavior though. Try not to touch your own mouth or your own nose. Teaching the other thing is to cover their children's mouth if they sneeze or cough. There are some kids that are amazing at this. In my office, I'm impressed with even kids under the age of 2 that are able to cover their noses when they sneeze. So don't put it past your child to not be able to do this. They can cover their nose and their mouth. One of the things I'd like to encourage you to do though is to not have your children cover with their hand if they can help it, but rather cover their mouth and nose with their arm. If we use what's called again the superhero, pretending you have a cape, cover their mouth and nose if they sneeze or cough with their elbow and sneeze into the inner part of their arm. The benefit of that is any germs they have will go into their inner arm and not on their hands. Certainly if they haven't got the time or they're not coordinated enough to do that, have them use their hands until they're able to do the other. But then after that, we have to remember to wash those children's hands. This is important in schools, play groups, anything. If you're in the middle of a play group and your child suddenly sneezes into their hands, pull out that hand sanitizer or run to the bathroom sink if you can do so. It's one of the most polite things you can do if your child sneezes into their hands or coughs into their hands. Don't be afraid to run away and get those hands clean for the sake of others. Another quick trick is to have your child bathe when they come home. If your child's been at school all day or in a busy play group or anything like that, when they get home, consider giving them their bath or their shower right when you get home. Take off the clothes, throw them directly into the wash machine, and get your child into the bath or shower. Sometimes it's earlier than you plan, but it's certainly a great way to wash off germs during the after play group kind of time. The next thing I am going to talk about is one of the most important things that we have, and certainly the key to ending our pandemic with COVID. This is the good old COVID-19 vaccination. Right now, the CDC recommends that everyone over the age of 12 should be getting a COVID-19 vaccine to help protect your child against COVID-19. Widespread vaccination is a critical tool in the efforts to stop the pandemic. It's also a critical tool to stop your child from getting COVID. Believe it or not, COVID is something that does tend to spread much more rapidly in unvaccinated people. It spreads far less rapidly in vaccinated people. The question that I have, and if we'll look at these, is why is COVID vaccine so important? Why do we hear so much about COVID-19 vaccine? The bottom line, as I mentioned, is COVID-19 vaccine has a huge, high protection rate against severe illness, even in children. This vaccine has one of the most incredible protection rates of any vaccines we have ever studied. It's close to 100% for most of these. The other issue is that it decreases the severity and the likelihood of any COVID complications. This includes cardiac complications, respiratory complications, long-term fatigue that children may have, long haulers disease, and a big, complicated multi-system inflammatory syndrome that children have been known to have. Your child having the vaccine decreases their likelihood of any of these complications. Getting the vaccine also protects your entire family as a whole, as it decreases the transmission from one person to the other. If 2 people in your family are vaccinated and only one is not, the likelihood of that third person getting it is far less than if only one person were vaccinated. The one thing we do know is that people are most contagious only 1 to 2 days right before the symptoms show up. This means that we all have to be on guard in order to avoid getting COVID. Children alone are frequently one of the biggest carriers of viruses, just in general, including COVID. Interestingly, though, vaccinated children are far less likely to be carriers. This means they not only are less likely to get COVID, but they're also far less likely to have a state in which they can share COVID with others. This protects your entire family when that child comes home, including younger children or older people or anyone who cannot receive the vaccine. So your child getting the vaccine protects your entire family. Vaccinating also helps eliminate pockets of vulnerability where this virus can continue to mutate and replicate. Why is that important? Because although right now COVID may not be affecting children as much as it has been affecting older people, but new variants may be causing much more severe disease in children. So protecting our children from getting these new variants is critically important. Higher levels of immunity in general will also allow us to continue to get back to normal, where hopefully we will be able to have our children in school without masks, to be participating in sports, returning to school with full-on activities the way they used to be. And the bottom line is that vaccines do protect not just your own child, but to a very large degree, they protect others as well. Again, this goes back to the superhero idea. When you tell your child they're getting a vaccine to protect themselves, but they're also getting that vaccine to protect everyone and get rid of this virus, which is one of the things we want to do the most in this day and age. If you haven't yet gotten your COVID vaccine, I would highly encourage you to get there. Finding a COVID vaccine for your child is not difficult. You can call your primary care provider or your pediatrician. They will often have the ability to give you a COVID-19 vaccine. Some who are not carrying the COVID-19 vaccine in their office may choose to refer you out to a local pharmacy or to your local health department. Those both are sites where they are very safe to receive a COVID-19 vaccine for your child. There's a lot of big questions around the COVID-19 vaccine. I'm going to go through a few of these because they are constantly being asked. The first and most complicated or common one is, why does my child need this if the risk of severe complications is so low for children? We know that the disease is not completely benign in children. We have had COVID complications in the country, in our county, even in this city here that I'm reporting from. There are definite long-term complications, including these breathing problems I've spoken of. We found that there are memory and attention deficits that children have had long-term. There are mood and depressive symptoms that children get after COVID long-term. There are long-term fatigue syndromes, long haulers disease, and multi-system inflammatory changes. There have been over 500 deaths of pediatric deaths in the US at this point. This is not a high rate, but certainly no one wants to ever see a child die from something that we could prevent. One of the most scary things I have seen are some of our just regular children with COVID. The amount of stress that they have in their face and in their bodies to breathe is scary to watch. And I certainly would love to have every child protected against this terrible virus. The other question that's asked is, the COVID-19 was developed very quickly. Should I be concerned about the fact that it was developed so quickly? Aren't there steps that were missed or skipped? And the answer to this question is clearly no. The vaccine was developed quickly because scientists received a bunch of extra resources, support from multiple sources. This allowed scientists to follow all the processes that they typically do, but they just were able to overlap some steps. This completely sped up the process. They did not skip one single step. I want to reassure everyone listening to this, there were no steps skipped. The next question that's asked is a very funny one to me, is that does mRNA vaccine change your DNA, or that mRNA vaccine somehow incorporates into your DNA? The answer to this is clearly no. If you understand how the mRNA vaccine works, you would understand there is no way possible for an mRNA vaccine to integrate into your own DNA. The DNA that we have is inside the nucleus of our cells. Inside the nucleus is the center of your cell. mRNA does not get to the nucleus of your cell, doesn't even come close. So there is no way for these mRNA vaccines to integrate into your DNA at all. Be reassured by this. The next question is, does COVID-19 vaccine affect fertility? And the answer to this, again, is a clear no. Getting vaccine from COVID-19 does not interfere with boys' or girls' future fertility. This was some rumor that started and created a great deal of misinformation. It's understandable when information gets on the websites and starts being spread all throughout the internet. Sadly, the internet is not a source of medical truth. We really do need to listen to the sites that I've cited for you and will cite for you again to get to the true medical truths. There is a video that I would love for anyone to watch who's concerned about this. There's a website put out by the American Academy of Pediatrics. The American Academy of Pediatrics is the branch of the medicine of pediatricians who outrightly have fought for everything there are for children's protection and health. They have a website that's specifically geared towards parents, where they take critical information that we know and explain it in a way that it's very easy for parents to understand. This website is called healthychildren.org. Again, it's healthychildren.org. This is a great source for much information, but it does have a wonderful video that talks about the fertility question that many people have had. Another question is, many new parents or second-time parents will ask if it's safe for them to get the COVID vaccine if they're pregnant or breastfeeding. And the answer is clearly yes. This has been studied clearly by some of my colleagues in the OB or obstetrics and gynecology department. It's also been recognized by the American Academy of Pediatrics, and it's been known by more than a dozen other medical associations and organizations that this is a safe vaccine to take during pregnancy and breastfeeding. Not only is it safe, it has saved many, many complications in late pregnancy and in early newborns. Another question is that, does the vaccine work against the Delta variant? The answer is, again, yes. This vaccine does work against the highly contagious Delta variant. Some people may have gotten the Delta variant despite being vaccinated. This does not mean it has not helped them. The vaccines have been proven to reduce the risk of contracting COVID-19. It's been proven to reduce the severity of your COVID-19 illness, should you get it. And it has almost eliminated hospitalizations and deaths of COVID-19, even from the Delta variant. So thus, you may find some people who are vaccinated that do get the COVID-19 virus. The symptoms, the outcome, and the complications are far, far, far less than those who get it who are fully unimmunized. Another important question that beats to my heart is one that so many parents are concerned with, which is the question of, does COVID-19 vaccine cause myocarditis or inflammation of the heart? We have found with time that myocarditis, or the inflammation of the heart muscle, does appear to be a very, very rare side effect of the mRNA COVID-19 vaccine. What is surprising to me is how few people realize that COVID-19 virus itself causes myocarditis and pericarditis. And the myocarditis and pericarditis that are received from the virus itself are far, far more common in people who contract the virus than people who get the vaccine. If you really look at the numbers and the statistics of this, what is interesting to see is that the inflammatory infection that comes from this virus is 300 times more likely from the virus itself than from the vaccine. So though there are cases reported of myocarditis or heart effect from the vaccine, if you look at the same exact population of people who did get COVID virus itself, they have a 300-fold more likely chance. And that's an important thing to know, because certainly if you're worried about your heart, the thing I would worry about the most is getting the virus itself. These numbers are in the medical literature. I know it's hard sometimes to take my word for it, but they have been studied and they're clear in the medical literature, in which I will cite at the end of this talk. One of the most important things we will talk about as we go on, as I had mentioned, is to watch over asking about your child's health, observing your child's health, listening to your child, and then obviously, as we mentioned, to do something. You alone can also help stop the spread of COVID. Monitoring yourself and your child's health are critical in this. Watch to see if your child is feeling okay. If your child is sluggish or not feeling well, if they're stuffy or congested, try not to blow this off. If they're not feeling well, if they have a cough, if they're congested, runny nose, sore throat, any of these items, please, please try to keep your child at home. Most often our children are not having COVID when they get these symptoms. Luckily, a lot of what we're seeing are turning into routine colds and coughs of a number of different viral illnesses. But every once in a while it does become COVID, and it's important for us all to make sure we take care of those children quickly and keep those children from seeing other children. So back to the term of self-isolation and quarantine. Certainly if your child is sick, we ask you to isolate them, meaning keep them home until you know what's going on. If your child is sick and they clearly have had a contact with someone with COVID-19, that's where we ask you to do the 14-day quarantine. Those things can all be discussed further for you and your doctor, but the bottom line is if your child is sick, don't be afraid to ask, and please keep them home from school. The other things we want to do is keep our children safe from other health illnesses that can come into play while we're kind of avoiding things during the COVID pandemic. What am I talking about? I'm talking about routine healthy checkups. It's important for your child not to miss those healthy checkups. We have many kids that are missing their routine children's immunizations. They may be missing their vision checks, their hearing checks, going on about their regular school days, not knowing that they're having difficulty with their eyes or their ears, some long-term problems that may not being addressed. Dental checkups seems to be a very big one. Many people have skipped those appointments, and those are critical. I think the rate of dental decay is going to be enormously out of proportion in the next 2 years from people kind of missing those routine appointments. So I want to urge you, get your children in for their well child care. Get your children in for their dental visits. Have any testing done that needs to be done. In addition, we talked about bringing your child in if they're sick. One of the things I want to talk about is to call your doctor if your child becomes sick. Don't forget to call and ask, what should I do? The bottom line is some doctors' offices have these systems set in place. Other doctors' offices do not, and they really do need to kind of walk you through what to do if your child may have a high risk of something related to COVID. Patients that have a little higher risk of COVID may be directed in one way versus those who are not. So call your office. Don't be afraid to go in, but call your office first before you go. The other thing I want to emphasize, as many of us have heard, is the importance of getting your children attention if you do see any signs of mental health. If your child seems to be depressed, if they seem to be down, aren't sleeping, aren't eating, have low energy, don't seem to be getting near their friends, any signs of depression or social withdrawal, those need to be called again to your doctor and ask for help immediately. It's been a long year and a half, and some kids are tolerating this far better than others. But if you don't feel your child is doing well in the mental health aspect, please reach out. Many of you have ability to call a mental health line on the back of your card. And what's amazing is if you turn the card over, a lot of times it'll say mental health. You can sometimes call without even reaching your pediatrician to get a psychologist or psychiatrist to be helpful to evaluate your child. If in doubt, your home doctor will always help you direct to the right place. These things are incredibly important as the days have passed. So in summary, I'm going to put up a couple slides again to reemphasize the correct place to find the correct COVID-19 resource and information. There's a great deal of information out there, and again, I want to urge to you guys, internet is not a medical resource. There are some great sites, and your doctor may be happy to show you which ones they like. These are sites that we trust. This first one, as you see on the screen, is the Centers for Disease Control, or the CDC. You can type in cdc.gov or just CDC, coronavirus information. One of my favorites, again, the AAP. By putting AAP, or American Academy of Pediatrics, space coronavirus, tons of information will come up. There's also the CHOC website, which is a very amazing site for new parents, experienced parents too, but amazing. We have a number that we developed at the onset of COVID. The number is 1-844-GET-CHOC. Again, that's 1-844-GET-CHOC. It is a site that you can, or a phone number you can call to get help both for your child who is not feeling well with COVID or your child that you're just not sure what's going on with them. We have nurses that staff 24/7 and along with your pediatrician serve as an amazing resource for help. The amazing thing about the CHOC website, as I'll show, they have some pretty simple little sites and little sections that kind of give you some ideas. Summer activities, things to do with your teenager, questions about vaccines. And they will certainly update this coming up soon when we get some more information about the vaccine coming for the 5 to 12-year age. So when something new comes up, reach out to your local children's hospital. Look for that. Look at your websites for the healthychildren.org from the American Academy of Pediatrics or the CDC. When new information comes up, look to the correct resources. Don't rely on the internet. Don't rely on Facebook. Lots of bad information can come from Facebook. Lots of good information may come, but you just don't know what's right and what's wrong. How do we end this? The end comes with everybody having the knowledge that hopefully we've discussed today. It comes from everybody working together to fight COVID-19. As soon as we have decreased our numbers, as soon as people are having far less COVID in our community, that's when we'll be able to go back to life as we knew it in the past. And my hope is that that will happen very quickly. My encouragement to you all is to do the things that we've talked about. Try to get your child vaccinated if they are of the age to be vaccinated. Wear your mask whenever you can. Use your hand sanitizers. Use your extra gear such as glasses and face guards. Stay at home when you're sick. I can't emphasize that enough. Try to avoid other friends that have sick kids. Try to avoid large crowds. Try to avoid people you see in the halls that aren't looking healthy. Most important is for you to realize you and your child can all stay clear of COVID-19 by taking a couple simple steps, and it can also help prevent the spread of COVID-19 in our world as a whole. Okay, it looks like there aren't any questions. Hopefully that's a good thing. Hopefully it's not too new of information, but again, rather some practical tips and tricks that you can use. Actually, I forgot to mention one. Now that we're on the end, it's kind of a fun one that I forgot to. I had a parent, which a lot of my information comes from parents, that actually had a pack of bubble gum. This is mint gum, but it was in her purse. And ironically, it was next to the mask, so her child put the mask on and said, "My mask smells like bubble gum, Mommy." And that, she said, became her favorite thing to do. She now keeps her masks in a purse right next to the bubble gum. It's certainly a fun way to make the kids wear the masks. So this is what my point today is, to make this as fun as possible, to help your kids engage, have them be the superhero to fight coronavirus, have them wear the fun masks, have them do whatever you think they can do to partake, to stay healthy themselves, and to fight coronavirus. Those big superheroes I have in my office love being the superheroes. So make your child a superhero. You also can make a big difference, and that's where I want to say thank you to everyone for listening, and I hope you guys all stay very safe. Thank you.